Okay, what's up everyone? Live from the beach. I'm trying to make this a little bit more interesting background than usual. It's a little bit different this week because, as you may or may not know, the Dr. Giancarlo Instagram has been shut down for impersonating others. And you guys are gonna laugh because you guys all know that one of the biggest things that I complain about is catfish and people that steal my photos and try to fool people. And so the catfish, I guess, are winning this round. They claim that I am the one stealing the photos, which obviously is not true. I'm the real Dr. Giancarlo, you know, whatever. So trying to keep a positive attitude for now. I will do the lives on here every Wednesday, same time. Hola. I will, yeah, it's kind of random what Instagram did to me. They think I'm the fake. So I had to send in like a mugshot with my driver's license with a passport, and I guess I'm just waiting for a human to evaluate and they'll see that it's me. So until that happens, I'll be on here doing the lives. And if you guys have questions, as always, just type them with that little question mark in the bottom, and we will go from there. Okay, so I'm gonna jump right in. This is like a common question that I get is, do you have a least favorite procedure to do? And I think, I enjoy all the procedures. I think my least favorite thing to do is when, what would be my least favorite if I was honest? Because I kind of enjoy all types of plastic surgery. I don't know. I'll think about that one because I don't really have a least favorite, and I don't want to someone's gonna be like, oh, you're doing my procedure and that's what you said is the least favorite. And I don't think that's fair because sometimes cases can be more tougher than others, but I like challenge. You know what I mean? So that's a good. Once they see that your page should be back up and normal with every post, it happens to me. Yeah. So we'll see what happens, guys. I will keep you updated as soon as I have my page back. You guys will know. Okay, so do you have a favorite procedure? So my favorite procedure is usually my last procedure. So today I did a tummy tuck, and that's my favorite because it went well. It looks amazing. You can see it in the stories, and I kind of like as we go every day. That's the last thing I did is my favorite procedure. So Mutia Subrata, what are the risks if someone does liposuction? So the most common thing that can happen after liposuction is irregularities. So what does that mean is when I suck out the fat, there's little dimples, or the skin is a little bit loose in some areas and it's tighter in others. It's kind of a little bit because of your genetics. Sometimes with the healing, the skin doesn't heal evenly. Sometimes it's the surgeon. We leave a little bit more fat here and a little bit less fat there. The best way to kind of avoid these risks is to get massages. So, 2 to 3 massages per week for 4 to 6 weeks after a liposuction procedure can really help even out those little irregularities that can happen after liposuction. There's a lot of risks with any surgery. I had a patient today that was like, her eyes got scared when I talked about risks. You guys have to understand that with any surgical procedure, there is a risk of bleeding, there's a risk of infection, and there's a risk of wound healing problems. Those are the top 3. It doesn't matter the surgeon, it doesn't matter the surgery. Those are the top 3. And you might say, well, why do those happen? Well, because surgery, I look like I have a huge mullet. Sorry, guys. Because surgery involves getting cut with a knife, right? And when you're cut with a knife, and you're healing, there's that risk of bleeding. Surgery also involves opening up the skin, so bacteria can get in. So that explains infection. That's always a potential risk. And the third thing is wound healing. So I've run into this recently with a couple of patients. They heal perfectly on one side, or they heal perfectly along the abdominoplasty incision, and then one small area opens up, and then it needs wound care. So wound care can be easy, like polysporin every day, or it can involve packing a wound. You will heal if you do the simple things. What are the simple things? Getting a good night's sleep, eating a healthy diet, not smoking. Oh, watch the cord. Julia's sabotaging the live right now, like big time. Careful. Just gonna pull out the phone cord. Okay. That was Julia sabotaging. I got this outdoor setup, guys. So, anyways, I hope you enjoy it. You got the beach right there. Excelente. Okay. So, let's see. Chatter. What is the reason for spitting stitches? It's a common trait I've seen. Yes. So it's a good question. So when I put you back together, I use stitches, right? That's how surgeons close the wounds, especially around the breast. Like the nipple is like this. We put stitches all the way around the breast and at the 4 kind of poles. And so what happens is your skin doesn't like stitches. So the deeper the stitch is, it's not a problem. But the more superficial it is, the skin will spit them out. And this is just a reality of surgery. Sometimes I need to put the stitch very superficial because I want your skin closed together. And if the skin heals over the stitch fast enough, the stitch won't spit. But sometimes your skin doesn't heal as fast as the stitch comes to the surface and then it spits. It's not a problem, you know, it's just your body getting rid of the stitch. Remember, I use all absorbable stitches. They're all absorbable, no permanent stitch, but these stitches will last for like 4 to 6 months. So that was the long answer. The short answer is spitting stitches happens. It's just something, you know, you can send me a photo or, you know, you can ask me. Sometimes if you live nearby, we can just trim it with scissors. But you should always send me a picture first and say, hey doc, what is this? Just to make sure that it's not a infection or something bad. Let's keep going. Chappies baby, I'm 10 weeks, hi Chappies. I'm 10 weeks post-op and my butt still hurts when I lay down. How long do we stay tender to touch? That's interesting. So usually I'd say the most aches and pains are about 6 weeks, but that can vary from person to person. I think if you're still sore in certain areas, the best thing to do is keep massaging, keep stimulating those areas. You can be sore and sensitive for 6 months after surgery because your body is just getting used to the new position, the new skin stretch, the new changes. You know, with a BBL, you have fat that's been injected into the buttocks. So, you know, I would say if it's just tender, it's nothing to worry about. But if there was signs of an infection, might be like redness, a fever, these kind of things. So for a BBL, the most common reason is just adjustment, and just keep doing massages. Really, that's the best answer for that. Okay, let's hear this next question. Guys, if you have questions, please use the question mark in the bottom and type in your questions. I will get to everyone's question. If you're just tuning in, I've got the beach background. You can hear a little bit of waves and traffic. I don't know. It was an idea I had to mix it up for the live. Okay, so here's the question. Ditzy Mitzi, does tummy tuck wrinkles after tummy tuck occur because of too much loose skin? Why? Well, it depends on the wrinkles. So sometimes you guys forget your tummy has to flex, right? If I made you so tight, you'll be walking around like this for the rest of your life. You need some loose skin on your abdomen. Like before a tummy tuck, when you sit down, everyone normally has a little pouch of skin. That's normal because your body needs loose skin. It's like your elbow, right? When you open your elbow, you have lots of loose skin. Why? Because your elbow has to flex. It's the same thing with your tummy. You have to be able to sit and stand. So some wrinkles are normal. Now it depends. I think you may be talking about the wrinkles that go up and down. That's because when we're doing the tummy tuck, we pull down, we pull in, but you may have extra skin horizontally, not just vertically and on an angle. So usually those wrinkles work themselves out over the next, 3 to 4 months after surgery. And that's just the reality of the kind of angles of that we're pulling the skin. Okay, let's see. Question, it's Miley Pam. Isn't it dangerous to do too many procedures at once? Example, a mommy makeover, a BBL, and a lipo 360. So listen to this, guys. Any surgery is dangerous if it's not done by a qualified professional or a surgeon with experience. You could die or have a complication from just doing liposuction. You could have a complication from just doing one procedure. It's not really the amount of procedures that's done, it's how safely they're done. Now, you're absolutely right. If you're being operated on for an extended period of time, over 5 hours, over 6 hours, and you're having your total body operated, you're absolutely right. That's not safe. But if a surgeon like me who does mamacita makeovers all the time, and I'm never longer than 4 hours because I have the right team and I have the right plan in place and I do it all the time, then it can be safe. So it's not really to say, is it the number of procedures or is it a timing of procedures? It's a multifactorial thing that depends on the patient, depends on the surgeon, and it depends on the time of the operation, right? So I never do unsafe operations. Sometimes, you know, I have patients that have weight loss surgery, like that have had weight loss surgery, and they come to me, they're like, I want to do my arms, I want to do my thighs, I want to do my stomach, I want to do my breasts, I want to do my butt. And I'm like, whoa, 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 whoa. That's too much. I'm only one man. That would take me the entire day. And you can't do surgery for 8 or 9 hours. That becomes unsafe. So I ask to break it up. And it depends on, you know, the size of the patient. Sometimes patients want to do a mummy makeover and their BMI 34. I'm like, we can't do it. You got to lose weight. So it really depends. It's multifactorial. So I hope that answers your question. It's a bit of a complicated question, and it's not a one-size-fits-all answer for every patient. When can I sleep on my side after a mommy makeover? I like the beach chair position for the first week, and then after the first week, you can start sleeping on your sides. If you had a BBL after the first week, I like you to start sleeping on your stomach. And I hope you guys like the background. Okay, Trini Lily. Why are ab boards important? Love-hate relationship over here. Yeah, so I actually noticed a few patients recently that are wearing the ab boards too tight and they're getting lines in their skin. Your skin should not be compressed or getting lines in it from the ab board. If that's the case, you need to stop using the ab board. You know, I like with the foams underneath the ab boards, and all different surgeons, you do different techniques. I love the ab board because it gives that extra pressure to get that fluid out of there and get things nice and tight. But there's, like in anything in life, you can do too much. And I feel like if you're wearing the ab board so tight that it's giving like skin damage, it's wrong. It's kind of like after surgery. I tell you guys to walk, and I've had a couple patients where they're like running marathons after surgery. Like one patient I had was doing like a 30-minute walk every 2 hours the night of the surgery. Again, it's too much of a good thing and you're gonna run into problems. So I know it's a complicated answer, but surgery is complicated. You wanna find a happy balance. So for example, I like you walking right after surgery, okay? I don't want you doing marathons, and I don't want you laying in bed all the time, right? So it's in the middle. A little bit of walking after surgery. It's same thing with ab boards. I want ab boards, but I don't want extreme tight like ab board where it's causing skin damage, and I don't like no ab boards. So again, it's kind of like in life, you gotta find that happy balance. Another interesting one is eating. I always tell you guys, slow down the night of surgery. Liquid diets, soft food diets, and some patients just are like shoveling food into their mouth after a tummy tuck and they vomit it up. Again, it's like finding that happy balance between eating the right amount with your new body and not, if you don't eat enough, that's bad. And if you eat too much, it's bad after surgery. And so here's how much walking after surgery do you recommend? I literally recommend on the night of surgery, just walking around your bed, around your room. You know, that's it. You know, just getting the calves pumping. And people say, oh, you want to walk after surgery? So they're doing laps of the hotel on the night of the surgery. Like, that's too much. You're gonna get a hematoma. You're gonna get a bleeding problem because you're gonna be like, you know, exercising the night of surgery. It's too much. Okay, so I'm gonna, let's see here. Oh, it's a long question. Let's see, there's a long one. I'm a top surgery. I have dents where the keyhole, I still have a dent. Will it go away at time? So if you're a patient of mine, I don't recognize the name, then just send me photos. And if you're not a patient of mine, send me photos anyways, and I can give you my recommendation. Usually where the drain was, it's just a 1 centimeter hole. So if the scar didn't heal well, it's easy to cut it out and just give you a nice flat scar. If it's a raised scar, sometimes injection of Kenalog. So scars, you know, I know you guys are very concerned with scars, as am I, but oftentimes there's little things you can do to fix scars that don't necessarily mean new surgery. What do I mean by that? Sometimes you can treat, you know, scars that aren't nice with lasers that can make the scar less dark in coloration. If the scar is too thick, you can inject steroids to kind of soften it. And if the scar is really bad, we just cut it out and sew it again. And oftentimes, the second time around, it will heal better. Let's see. Do you recommend cavitation following lipo? I'm not sure what that is. After liposuction, I recommend fajas, which is pressure garments, and massages. I think that's the best thing after liposuction. Here's a question from Lovely as Can Be. Does a BBL help with the appearance of dimples one may have on their butt and side areas? Yes. So I get this question all the time because a lot of women have cellulite and irregularities. A BBL can help that. Why? Because when I'm doing the liposuction, I'm breaking up all those uneven irregularities, and it's going to cause a smoother buttocks. And then if I inject the fat evenly in those areas, it's going to improve it. Now, it's not, don't get me wrong, I'm not saying it's going to fix or cure cellulite, because that's not true. You know, cellulite is a defect in the skin, but it can improve the appearance because I'm breaking everything up with the liposuction. So I would say the answer is yes to that question. Okay, what's this question? Okay, so again, if you have a very specific question about your specific anatomy, please submit your question through the email to the link in my bio, and I'll take a look at your photos, okay? No problem. Chapis baby cavitation is the... You guys are going to have to send me exactly what you mean. I'm not sure what you guys mean by this cavitation machine. You know, I use certain devices. I don't use a cavitation machine. I use a liposuction machine, so I'm not sure what... Is that like you guys are getting that in your massages or what? I don't know. Okay, Lovely as Can Be. What does a companion actually help with if we need one while we're down there? So your companion is your second most important person after choosing your surgeon. Well, I think Julia is probably number 2. It's me, number 1, and number 2 is Julia, and number 3 is your companion. No, I'm just joking. I actually really think your companion is the second most important person. Why do I think that? Because think about this. You're stressed. There's going to be so much instructions. There's so much information, and you might be sore. You might be out of it from the surgery. The most important thing is having someone reliable there that's going to help you, remind you of all the important instructions that you may forget, right? Like, I try to keep it very simple. Take your pain meds, prepare for drainage, go for little walks, and call me if you have questions. I keep it like simple because around the surgery time, we tell you everything, but you guys forget it because you're stressed or you're in pain or there's a lot of stuff going on, right? Surgery is a big event. So your companion is someone who's going to help you, remind you of all those important things. You know, the best person actually is a loved one, like your mom, your sister, your aunt. You know, husbands can be hit or miss because they're not the best caregivers. Usually husbands are the ones, as Susie wrote right there, husbands are the ones that need taken care of. So a companion really is there to support you and be a positive influence. I've had a few people that had to beg someone to be your companion. If you have to beg someone and it's already off to a negative start, that's not your companion. You want really a surgical sister, someone who's gonna really help you through those dark moments, help you through when you're feeling grumpy, help you through when you're constipated, help you through when, you know, you wanna say, oh, Dr. G hurt me. I mean, I'm sore everywhere. And they're gonna look at you in the mirror and go, yeah, but look at your body. Like, take the pain meds, you know, glass is half full. You want someone that's positive. And so I think the companion is so important. Now, if you don't have anyone, we have companions that we use. We have a few services that provide this service. They're going to help get you to and from surgery. They're going to give you the pain meds. Hola, señor. You know, they're going to give you all the instructions. So that's available. Okay, guys. Okay, let's see. Reshaping Leo. Can the incision feel thicker or flatter with fluctuations in swelling? Yes, it can. Sometimes incisions, you know, it's the scar, they really take a year to heal. So it's kind of amazing the healing journey that you guys are going to experience, you know, especially when you have a big surgery. You know, the first thing is the skin, and that takes months to kind of resolve. And the last thing is that scar. So that's why I always recommend the scar tape or scar gel, staying out of the sun, and even massages of the scar. So the scar is a really interesting thing, and it takes about a year to reach its final appearance. So yes, the answer to that was yes. Is cellulite curable? No, at this point, there's a few different, you know, medications, injections. There's a brand new cellulite injection that just came out. I think liposuction that I do, I break up all the scar with the mechanical kind of device that I use, and that's going to help with the appearance of cellulite. But there really is no cure for cellulite, because cellulite is your skin. It's just some people are prone to it for it's actually a defect in the dermis and the deeper structures. So it's not curable, but we have ways to make it a little bit less severe. Let's see. How soon can you lift after a tummy tuck? Good question. You can go back to the gym at 6 weeks doing light activities and 3 months till you're doing heavy lifting. Like if you want to do heavy squats, heavy deadlifts, 3 months. Why? Because anything that engages your core muscles, I want you to take a break from. I do the muscle repair really tight. As my patients tell you, the corset is really tight. And so if you do heavy lifting right away, you could loosen that repair. So 3 months for heavy lifting. I had a patient ask me about like kickboxing and like MMA fighting. I said 3 months. Is swelling something that will always last, or will it eventually go away? So swelling is a variable thing. I like to think about it in stages. The major swelling, 6 weeks, it should be all gone. The minor swelling and fluctuating swelling that can sometimes happen with your menstrual cycle, and it can vary from person to person, is about 6 months. And then it also depends on the anatomic area. The nose swelling can take about a year. But for tummy tucks, body lifts, liposuction, probably about 6 months, the majority of the swelling is going to be gone. Let's keep going here. How long for stitches to dissolve? So it depends on the stitch, but usually it's anywhere from 3 to 6 months for the most of the stitches to dissolve. And I use stitches that last longer, deeper. So if I have to do deep stitching, it's about 6 months. Around the areola and the nipple, I use a stitch that only lasts about 3 to 4 months. What type of diet is recommended? I heard swelling is horrible. Okay, so those are kind of like two comments, a little bit different. So what type of diet is recommended? So the diet depends on the time of surgery. Before your surgery, just eat a healthy diet. Lots of vegetables, lots of protein is amazing. You need that healing in you. No one should be eating, it's like what your doctor tells you, what your mom tells you, don't eat too much fast food, don't eat fried foods, don't eat, I eat fried food sometimes, I shouldn't say not at all, and a diet that's low in sodium, something that's healthy for your heart and your body for the rest of your life. The night of surgery, I want you just to be drinking fluids and maybe a soup, maybe a yogurt, just soft foods and liquid diet. The same goes for the first day after surgery. Don't try to eat too much too soon. You're gonna get nauseous, or you're gonna have vomiting, right? And then the second day after surgery, you can slowly start going back to a normal diet, okay? Shardir, how long will I have to wait to get breast done if I'm breastfeeding? 6 months. So what I always tell you guys is that if you've just given birth, you've just had your baby, you need to wait at least 6 months before a tummy tuck. And if you're breastfeeding, you have to wait at least 6 months after you finish breastfeeding for breast surgery. Let's see. I love this question, and the answer is no, but I gotta read this out. You guys are gonna laugh. Since you have a special, get the second surgery half off. Could a friend get the second surgery half off instead of me getting multiple procedures done? No, that's not the way it works. The reason you get the second procedure at half off is because the most expensive part is putting you to sleep and getting you into the operating room. So if that means that your tummy tuck is full price for the first thing, it's because you're now in the operating room, you're asleep. And so a second procedure costs me less. So I pass those savings on to you. If your friend wants surgery, I have to put them to sleep, and then they can get their second procedure at half off. You get it? If the other friend is getting the procedure at half off, I'm completely losing money on their surgery. No problem. I get that question. Don't feel silly about that question, because I get that a lot, and I'll answer it every time. Lovely as can be. So how long is surgery for a mommy makeover? It depends on the person. Okay. It depends on your BMI. It depends on how much breast work is being done. It depends on the complexity of the case. It's anywhere from 3 hours to 4.5. It really varies. So It depends on a person-to-person basis. I never do more than 2 Mamacita makeovers a day. I never do more than 2 patients a day. And I never do surgeries that last longer than half a day. What's half a day? About 4 hours. I operate, 8 hours per day. So I hope that answers your question. Let's see. Thanks. My son is 1. I'm literally trying to get him off my breast. I love your breast augmentations. Okay. No problem. I understand. And yes, please keep 2020 great questions, keep them coming, guys. And I hope you like the beach background, so we can hang out together at the beach, answer some questions. And for you guys just tuning in, this is the real Dr. Giancarlo. I'm not a catfish. My other Instagram account has been deactivated because Instagram thinks that I'm stealing people's photos, so hopefully that gets sorted out. So anyway, 2020 surgery doll. Do you repair a hernia with tummy tuck? Yes, if it's a small hernia. So guys, if you don't know what a hernia is, if these are your abdominal muscles and this is your belly button, a hernia is when something comes out, okay? Now you're never gonna, here's a hernia, right? When something comes out through the abdominal wall. If it's a small hernia, because a lot of you guys have a wide muscle separation and then you have lots of emptiness in the belly button and you get small hernias around the belly button, I will fix that as part of the surgery. But if you have a really big hernia, then you need to get a general surgeon to fix it with a mesh first, right? Like some people have such a big defect where, there's a big piece of bowel sticking out through the muscle. No, your general surgeon needs to fix that with a mesh, and then I'll do the tummy tuck. Yeah, just think of this, okay? Little hernia, a little hernia, I will fix. Okay, let's see. Let's see. Just going through the questions here. Is it okay to take a benzo for our flight over 2 weeks pre-op? Yeah, that's fine. If you really need that, just don't take it right before surgery. Don't take it within a week of surgery because that can affect the anesthesia. Becoming a doll 21. Do you ever run any specials? Yes, I'm so happy you add. I have a special running right now. It's called You Special because you guys are so special. The first procedure is full price. The second procedure and subsequent procedures are all 50% off. Yes, you heard that right. It's the You Special because you special. And you can get it right now while supplies last. 2020, is it possible to have more than one hernia? Yeah, it's definitely possible. But probably if you have more than one hernia, you're gonna have other problems going on, and you need to see a general surgeon to get that fixed with a mesh. Okay, Shay, if I have a hip tattoo, will it be removed with the tummy tuck? It might be. So guys, remember, below your belly button to about 4 or 5 centimeters above the vagina, all of that skin is gone. So sometimes I remove tattoos and you guys are very happy, and sometimes I cut through tattoos. I think the most important thing is you want me to get rid of as much skin as possible, and if there's any tattoo left over, you can get that touched up at 1 year. And you guys always ask, when can I get a tattoo? 1 year after the surgery. Why 1 year? Because I want your scar fully healed. Okay, let's see this one. Love it. When getting a breast lift with implants, is a mesh bra included? I've heard talk. No. So this is a very popular new topic that's happening, is the mesh. So what is a breast mesh? A breast mesh is basically an absorbable material that I put under the implant to act as extra support. Not every woman needs this. I know a lot of clinics in Miami are pushing this because they want to sell you more stuff and they want to make more money. If you have normal skin and your average sag of your breasts and you're getting a lift with implants, you do not need a mesh. If you have weak skin and you've had massive weight loss and you have that really thin paper mache skin with lots of stretch marks, then you might need a mesh. But not everyone needs a mesh, okay? And I will be very honest with you guys when you ask me or come for a consultation. There's a question. Is there a reason why some BBs look like cat butt? I have no idea what that means. I have no idea. I really don't know what that means. Okay, Crystal C. Lopez. I've lost a ton of weight and I want to get work done, but working on building muscle and toning up. Oh, wood toning up. getting work done be beneficial? Yeah, of course. So guys, I'm a big believer in living a healthy life and getting your best body on your own. What does that mean? Eating a healthy diet, exercising, living your best life. You know, the more in shape and fit you come to surgery, then I can make you even better, right? I feel like the best results are when you guys put in work and I put in work, and as a team, we give you your best body. You know, sometimes people are like, oh, Dr. G wants me to lose weight, so I'm gonna go to this other surgeon that's not gonna make me lose weight. I get it. But if you're lazy, you're sacrificing your own results, right? If you don't wanna put the work into your body, what think about it common sense, right? Who's gonna get a better result? Someone who exercises, eats healthy, takes care of themselves, and gets plastic surgery? Or someone who does none of those things and gets plastic surgery? You already know the answer, right? If you take care of yourself, you take care of your skin, you don't smoke, you drink the appropriate water, you get regular exercise, you're already giving me better material to work with, right? And especially if you have muscles, muscles are sexy. Muscles are the best. If you are building the gluteal muscles and I put fat on top of that, you've already got 50% better results than someone who has no gluteal muscles, right? So every time someone asks me that question, please think about it. You will get better results the more you put into it. I always give a 110%. I will give you my best possible work. And a lot of what I do depends on what you give to me. So yes, weight loss, exercise, eating healthy, and you're gonna get your best possible results. And Reshaping Leo right there, she did the hard work. She put the work in, and then I did my work to give her those resultados excelentes. So yes, please exercise. Put your work in. How long before belly button heals? I'm 10 weeks and it looks dark and still healing. So belly buttons and nipples take the longest to heal. Just be patient, be patient. If there's any open areas, use Neosporin. If it's red, sometimes incisions can use a little bit of injection of steroid to calm them down. But at 10 weeks, the scar is still early. Remember guys, scars take 1 year to heal. So around that belly button is like a really sensitive skin. Just give it time. Give it time. When can I start training my belly button? So I'm starting to do this more and more, guys. I actually like training the belly button. You might say, what is training the belly button? It's, you know, the belly button is a circular scar. And some people's scar, it wants to tighten and close. And then you end up with this little tiny belly button. So what I like to do is we put a little rubber stopper into the belly button at around 1 week time, so that, you know, over the next, 3 months, 4 months, you keep that plastic ring in there so that the belly button stays kind of stented open. And I think that's a good thing to do. Okay, so maybe now I understand your question. You're saying that the belly button, when it gets really cinched down, it looks like a cat's butt. And that's just because of scarring. Like, I always make the belly button big enough where I can stick my middle finger, my pointer finger into it. When I'm in surgery, I make it that size because I actually want it, I know it's gonna get a little bit smaller and maybe it's gonna end up so that my pinky finger. But the scar, when it's a circular scar, scars always get tighter. And so when it's a circle, it wants to constrict, right? That's just how scars work. How soon after a tummy tuck can I have lipo 360 and a breast aug? I like to wait 4 months, 6 months, just to make sure you're fully healed. I love doing lipo after a tummy tuck because you can really snatch someone. If the tummy tuck has been well done, that means you have no more extra skin. We can really give you a resultado excelente. That's kind of an interesting thing. This is like plastic surgery level of thinking. I used to really love to do a BBL first and then do a tummy tuck second. And you're saying, well, I thought you like to do mamacita makeovers and combo. I love combos, but there is some patients that want a really big butt. You guys want like that big J-Lo booty, Kim Kardashian booty. So doing it as a combo, I'm not able to give you as many liters. And so I used to say to you guys, okay, let's do the BBL, get you that big booty with all the liters that you can take on each side and expand the skin, and then do the tummy tuck second. But I'm kind of changing my opinion the more I do it, because I really like doing the tummy tuck first when the skin is soft and supple and it has never been touched by plastic surgery. Then I can snatch the hell out of the tummy, and we come back and do all the lipo, really sculpt out the abdomen, and then do the BBL. So that's kind of my thinking. Brie Beaupre, how's it going, Brianna? How long after a breast lift can I get a sternum under boob tattoo? 1 year. I want the scar fully healed, and then you can do the tattooing. If you do the tattooing a little bit too early, the scar can get maybe hypertrophic or irritated from the tattooer. Let's see. Would you recommend an IV hydration before a mamacita? No, I think that's a waste of money. The only people who recommend that is the IV hydration people. You know, you have an empty stomach midnight after surgery, and we do IV hydration. We start an IV before surgery. You know, if these IV hydration makes you feel better, it's not gonna hurt anything, but I don't think it's gonna do anything. Let's see, Instagrams 5. I read somewhere some doctors have you stop taking antidepressants before surgery. Is that the case for you? No, you can still take those medications. The medications I stop are like stimulants, like Adderall medications. When you do, okay, so this is the thing. I don't have, with medications, there's not a one size fits all rule for every patient. At your consultation, when you submit your information, we look over all your medications and we'll go over those before surgery, okay? I submitted my form on Friday, so you should hear. I usually respond within a day or two, and then we set up a consultation. If you have not heard from me, then just email us at info@drgiancarlo.com. I promise you, we'll set up a consult. When you guys use the link in the bio to send me your information, it comes to me, I look over your photos, and then I send you an email saying you're a good candidate or you're not a good candidate. Sometimes there's more difficult cases, and it takes me a few days to think about it and get back to you. So I will respond to everyone though, I promise. How long is recovery for breast augmentation? So recovery for all surgery should be thought of in stages. The first 6 days are the most sore, most uncomfortable, when you have to really, really be resting. The first 6 months is time for things to settle. The breasts are really tight, the skin has to stretch, and they drop. Some people online call this fluff and drop. And then it's about 6 months. It's about 6 months till your final result as well. So think of recovery in stages. Let's see this. Garcia, your thoughts on COVID vaccine before surgery? I think if you're lucky enough to have access to the vaccine, you should get it. There's no reason not to get the vaccines, especially in the United States. You can literally go almost anywhere, a pharmacy, Walmart, and get the vaccine. All of you guys should be wearing a mask when you're in public spaces, and you should be getting the vaccine, you know. I've had a few patients recently that need to get canceled and rescheduled for COVID, and I wish them the best. I hope they get, well. And it's just a reminder that COVID is still out there, okay? Just because in the United States we're doing really well, there's still a few thousand cases per day, and there's still people that are dying of COVID in this country. So please be careful. Please wear your mask, and please get vaccinated if you have the opportunity, okay? Okay, Garcia, my PCP will only do med clearance 30 days prior to surgery. Is that okay? Yeah, that's fine. I like the medical clearance as soon as possible. I don't think anything's going to change, and I like to know if there's problems as soon as possible. I get the PCP wants to do it within 30 days of surgery. That's kind of like an old school thing. That's fine. Do it and get it to us as soon as possible. Let's see this. Glass of wine, okay. Surgery on July 13th. So I like you guys to stop alcohol 2 weeks before surgery and 2 weeks afterwards. Alcohol can cause thinning of the blood. So if you come to Miami for plastic surgery, don't get lit. Don't go party the day before surgery. I've had patients who go suntanning before surgery, and I've had patients that go drinking before surgery. Both of those are bad. The drinking is bad because it can thin your blood and cause bleeding during the surgery. And the sunburn and not wearing your sunscreen is bad because that can also lead to more bleeding. If we have to cut through the areas of where the sunburn was, Sunburned skin is red, it's inflamed, it bleeds more. So don't do that. Wear your sunscreen. Let's go. This patient, I want the best results. Would you prefer tummy and breast first, then full lipo with BBL? I want the best results. So the best results depends on your BMI and your body goals. Like, I have some people that are so funny. They're like a BMI 25. They have very little fat on their body, and they're like, I want to break up my BBL because I want a mega booty. And I'm like, you don't even have enough. You don't even get a 1 liter off of you. You know, you can't get a mega booty. You know, it's just, I've had patients that request the mega booties, and you really can't do that in a combo procedure. In a combo procedure, I can give you nice curves. I can give you, you know, a natural result. I can get rid of the hip dips, and I can get rid of love handles. But it really depends on your anatomy, your BMI, and what you're looking at, okay? So best results is gonna vary from person to person to person. And that's why I do personal consultations. And you guys, it's funny, on lives, you guys want always like a black and white rule. You want a one size fits all solution. That's not plastic surgery. Plastic surgery is not one size fits all. It's very individualized. Now, I know I have a Mamacita makeover, which is, you know, 3 procedures together, but it's not the same Mamacita makeover for everyone. Some people it's extended tummy tuck. Some people it's just a regular tummy tuck. Some people it's like, you know, more BBL volume. Some people it's, I want a more natural result. And then the breast, it's the same thing. Some people it's an augmentation. Sometimes it's a breast reduction. So every body is different. And just because we're doing something that has the same name doesn't mean it's the same procedure, because it's a different person. This patient, you recommend a 30 BMI. Would it be okay if I drop to 29 BMI from getting a Mamacita makeover? Yeah, 1 BMI is not going to make that much difference, and you're probably going to be a little bit more in shape, a little bit more toned, of course. That's awesome. Go you, JJ Goose, I love it. You know, really, BMI above 30 is obese, you know? So that's like, when I say a BMI cutoff of 32, that's the maximum I'm going to do. It's kind of like, you remember in high school, guys, where it's like, in high school, you always ask the teacher, what's the minimum score to pass? If you were one of those students, you're already in trouble. You need to be aiming for an A+ in school. That's how you do well in school. You know what I'm talking about. In high school, you'd be like, miss, what's the minimum score to pass? If you're aiming for the minimum score to pass and you miss, you're gonna fail the test. So that's why, you know, when people say, what's the maximum BMI, what's the I already feel like those people are looking at they have the wrong attitude, because they're aiming for the bare minimum, which is 32 BMI. Really, you should aim for what is going to give me my best plastic surgery result. What is going to be my healthiest result? And usually that's going to be less than 30, because 32, you're still obese, right? Let's see. Janet, my PPCP, she will fax the clearance to you on the fax. That's on your form. Yeah, that's fine. You fax it to us, email it to us. Doesn't matter. Oh, look at this Army helicopter. That's very cool. Very cool. Okay, so how much fat do you take is 1 liter. And you guys want to know, why is it 1 liter? That's the law in Florida. If you're doing combined procedures, the maximum you can take out is 1 liter. If you're doing liposuction alone, like say I'm only doing a BBL, I can take out 4 liters. So, you know, if you're going to some of these clinics and you're a BMI of 36 and you're doing a combined procedure, trust me, it's not enough. Trust me. Trust me. Or they're doing something illegal and they're doing way more liposuction than is legal. You know what I mean? That's why my BMI limits are strict, because above a 32, you need more than 1 liter. I promise you, you need more than 1 liter. So if you're doing a combined in surgery and your BMI is higher than 32, I'm telling you, something is not right there. Something is off. It's not honesty. Can you do Botox? We can. We're setting that up. I'm setting up the Botox. I love doing Botox. I am amazing at Botox. I'm setting up for Botox and Proceso. Will lipo remove saddlebags? Yes, if you have saddlebags. So please send your information to the link in the bio. I will look at your pictures. I had a patient the other day that was like, can you remove my saddlebags during the consultation? And I asked her to send the picture for me to evaluate. She didn't even have saddlebags. So please submit your photos to the link in the bio and I will evaluate you. Is it okay to leave in the Nuva ring during surgery? Yes. That was the easy one. Beauty Culture Babe Marisol. What type of implants will give you the best upper pole fullness? Do you use it? So a lot of you guys get very hung up on the details of the implants. The most important detail is the size. A bigger implant is going to give you more projection, is going to give you a bigger breast. That's the most important thing about the implant. The profile, the brand, the texturization, the dimensions, none of it matters as much as the size. So I use, high profile or moderate profile implants depending, but really that's like a finicky detail. The most important thing is the size. So when we measure your chest, I want you to tell me, Doc, I want a more natural result. I pick a smaller implant, maybe a moderate profile. If you're like, I want a more exaggerated result, I use a bigger implant and I use a higher profile. Let's see, J-plasma question, is it done in place of lipo? No. So J-plasma should be thought of as premium liposuction. It only works after lipo. If someone's doing J-plasma without doing liposuction, they're scamming you. Why? The liposuction breaks up the tissue connections and sucks out the fat. And after liposuction, everyone has loose skin. Everyone. That's the point of the liposuction, is to break everything up and empty out the fat. Then the J-plasma goes under the skin and tightens all the connections, the deep dermis that connect the skin, and it kind of sucks it down. So think of J-plasma as premium liposuction, okay? It's a really nice device. I did it today on the back of the patient, and it's also amazing after someone's had repeated liposuction. Because if you had liposuction once, the second time the skin might not come down as well. So I really like J-plasma as an add-on to liposuction, okay? Let's see, if I'm nursing, when should I stop if I want a tummy tuck? So you can do a breast surgery 6 months after nursing. You can do tummy tuck 6 months after finishing the tummy tuck, okay? 6 months, 6 months, 6 months. When can you get back to physical activities like kickboxing or surfing? Oh, this is you. You're the very active one. 3 months. 3 months. 6 weeks you can get back to the gym, doing light activities for like MMA, hardcore stuff, hardcore core exercises. 3 months. Let's see. Can we talk underwear? Okay, let's see. Okay, let's talk underwear. You guys want to talk underwear. What type, if any, should we bring to wear after a mamacita maker? Curious about what to wear with the faja. So actually, you're not going to be wearing underwear when you're wearing the faja for the first few days. Why? When you wake up from surgery, you're going to be wearing a very tight faja, and it's going to have a hole in the vaginal area and we're going to give you a urinal that you can pee out of. You're not going to have to go number 2 right after surgery. I guarantee it, because of the you haven't eaten in a day and you have the narcotic medications, okay? Now, some women wear kind of like a diaper underwear over top of the faja. That's something you can do. But you're going to notice you're not going to be wearing underwear for a few days after the surgery, and you're going to be doing just sponge bathing. So I think it's a good question, but I really wouldn't worry about underwear in the first maybe week after surgery. Yeah, it's not going to fit. It's under the faja. It's a good question. Okay, so let's see this. What is the ideal BMI for best results? I have implants now that I need you to take out, lift, and replace. So again, you guys are obsessed with BMI because surgeons talk about it. But BMI is just a starting point, okay? BMI is a way for me to deal with patients, with a lot of patients, as a starting point, okay? So I have a maximum and a minimum. You know, if you're underweight, you need to gain weight for surgery. The minimum is probably 19 and the maximum is 32 for me in my practice. Now, the question is, what is the ideal Ideal depends on your body type. It depends on your anatomy. If all your fat is in your, I'll give you an example. If all your fat is in your thighs, and I'm doing a tummy tuck, and your BMI is 32, it actually is kind of like your BMI of 26, because all your fat is in your thighs. I'm gonna get you snatched, and your fat does not affect the tummy tuck. However, you could be a BMI of 30, and all your fat is in your tummy. I had one patient I just saw recently, it's like a spare tire. All of her fat, her arms are skinny, legs skinny, chest skinny. All of her fat is around her midsection. She actually probably needs to be a BMI of 27 or 26 to get a good result. So there is no single number for BMI for your best result. That really depends on your anatomy, and I will work with you. I will look at your photos, I will examine you, I will determine what is the best BMI. And that's why patients sometimes get I don't know, confused or upset when I'm like, I tell one patient, you need to be a BMI 28. I tell another patient, oh, BMI 32, it's fine. And sometimes, even before, when I had a more loose cutoff, I do a BMI 35, and then patients would be like, oh, well, you did this BMI 35, how come you did this patient? And it's because it's a case-by-case basis, And also another thing, which I'll tell you guys, is I learn as I do surgery. What I do now is not the same thing I did 3 years ago, 4 years ago. I've learned that it's very hard to give a predictable, good, safe result above a BMI 32. Right? So sometimes I lose business. I know I lose business. I know those higher BMIs, they message me, they're like, oh, well, I'm gonna go to Dominican. I'm gonna go to this other surgeon who doesn't care about my BMI. And I'm like, okay, it's your choice. It's a free market. If I'm not the right surgeon for you because of the BMI, I get it, right? Losing weight takes work. Losing weight is hard. Losing weight requires dedication. But you know what? I'm telling you to lose weight because I want to give you your best result. And I don't want you coming back for round 3, round 4, touch-up, revisions. This is like a cycle that the only person that helps is the surgeon's wallet, right? I want you to get your best result one shot. So what does that mean? You have to put your work in. You have to, get on the diet. You have to lose the weight. You have to come to me with your best possible starting point. And then I'm going to give you that resultado excelente. You know what I mean? And so ideal BMI, I know a lot of people get upset about it. A lot of people get confused by it. But I have to tell you that the ideal BMI is going to be different for different people. And really getting to a healthy body weight before surgery is not just good for the resultado, and it's not just good for the safety of the surgery. It's good for the rest of your life. If you're a BMI anywhere above 30, you're obese. What does that mean? You have a risk of heart disease, cancer, diabetes, renal problems. You name it, you're at a higher risk for it. So if you want to live a nice, long life, enjoy your grandkids, maybe great grandkids if you're lucky, you should lose weight, and then you're gonna get a better surgery result. So I hope you guys enjoyed the view today. That's my rant. Look at that beautiful sunset out here. Let me see. I got a few more questions you guys just put in there. I think it'll be $10 a unit for Botox. And the fillers, we got to work out the price. We're just working with the reps right now. We'll have the Botox and fillers very soon, okay? So the BMI limit is 32, okay? Will you do fat transfer to breast instead of implants? Yeah, I'll do fat transfer to the breast. You just guys have to understand that fat transfer to the breast is not as good as implants if you want a large change. What do I mean by that? If you want like a 400 or 500 cc implant, doing that with fat transfer is not gonna work. It's not the same as the booty. It's really weird, and we as surgeons and scientists, we don't know why you can put so much fat in the booty and it lives. And you can really change someone's whole body. You can give them a whole new booty and it works. Whereas in the breast, for whatever reason, you have to use less fat and it doesn't survive. And if you try to push it too hard, you get all kinds of problems with healing. You get cysts and you get scar. The breasts, for whatever reason, just don't tolerate as much fat. So for me, when I'm putting fat into the breast, it's less. The best patient for fat transfer to the breast is actually someone who already has implants and they want more. They want to enhance their look, or they have rippling in the top of the breast and they want to smooth things out. That's the best for fat transfer to the breast. Let's see. How many massages should you get after a tummy tuck? 2 to 3 per week for 6 weeks. Okay, that's what I say. You guys are welcome. I'm glad you guys enjoy the live. Let me see. Do you recommend muscle repair tummy tuck on patients that haven't had kids yet? It depends. I recommend muscle repair if you need a muscle repair. Sometimes, guys, if you haven't had kids, but you gained a lot of weight and lost a lot of weight, it's like you've had kids. You've been stretched and then you've shrunk down. So I recommend doing a muscle repair if you need a muscle repair. And sometimes just because you haven't had kids, those muscles are loose and they're separated, and I'm just gonna give you that internal corset. So yeah, you guys are totally welcome. Last 5 minutes, get your last minute questions in. I'll do this every Wednesday on Real Plastic Surgery. I know you guys really enjoyed it on Dr. Giancarlo. Dr. Giancarlo is in jail right now because of it's so annoying, but as you guys know, I have a lot of catfish accounts that steal my photos. And so what Instagram did was, I guess, a catfish reported me, or females, or someone that got scammed by my photos reported me as the fake. So right now, Dr. Giancarlo is deactivated. They made me send in a mugshot with like a passport and a driver's license to show it's me. Hopefully I'll get it back. I have no idea. Fingers crossed, dedos cruzado, because I had such a great account going, such great energy and so many followers. But I think in the end, it doesn't matter. I'm still me. We have this channel. If you really want surgery with me, you knew about this page already. You knew about my before and afters. The last thing I'll send a plug for before we go is there's a Facebook group. It's a great source of information. We put videos, patient experience. A lot of you guys can meet each other, support each other. We do moderate the group. We want to keep it positive. We don't really tolerate the negativity in the group. Hashtag free Dr. Giancarlo. Exactly. But if you want to join the Facebook group, it's called Dr. Giancarlo's Official Resultado Excelente Dolls. So if you go on Facebook and search for Dr. Giancarlo's Resultado Excelente Dolls, you will find it. I'll answer the last couple questions. Let's see. Do you automatically do the repair if you see it? Yeah, of course. If you guys need every tummy tuck includes a muscle repair, because usually if you need a tummy tuck, you need a muscle repair. It just goes together. A mini tummy tuck does not include a muscle repair. Okay, awesome. I love it. You guys are so pumped. Last couple questions. I'm gonna go till 6. Guys, I always give you your money's worth. If it's live at 5, I'll give you the full hour to the last minute. What kind of pain medication do you prescribe? Yes, so after surgery, I like multimodal pain medication. So what does that mean? It means, and I hate using narcotics unless we have to. Narcotics have all kinds of complications and problems with them, as you know. And so what I like to do is tramadol, Advil, Tylenol. Those 3 combined with local anesthetic wherever you operate, I use local anesthetic. The problem with local anesthetic is it wears off after 4 to 6 hours. So what I do try to encourage you guys to get is Exparel, because Exparel lasts for anywhere for 2 to 3 days. So talk to my patients, talk to the ones that have gotten Exparel. Usually they're very, very comfortable after surgery. Right now I'm at the beach. I just wanted to show you guys, this is where I live. This is like our balcony, Julie and I, and we get this lovely view. So I wanted to share it on the live today at 5. So thank you guys so much for your support. Thank you for your questions. I know surgery is a stressful process, so I'm just trying to make it as stress-free as I can. So thank you so much for your questions. Next week, Please bring all your questions, and I promise you I will do my best to answer them. Thank you so much for tuning in. And the Facebook group, as I just plugged, is Resultado Excelente Dolls. And that's it. I don't know what else. Maybe there's like one more just came in. Oh, this isn't even a question. It says Resultado Excelente in 29 days. I can't wait. Mamacita makeover coming soon. Okay, amazing. Oh, and we have some amazing. Okay, I'm not gonna spoil the surprise, but for people getting the Mamacita makeover, we are gonna have an amazing surprise for you. So stay tuned. It's coming soon for Mamacita makeover dolls. I'm so excited. And Susie Stark was our inspiration for this. So that's just a hint on what's coming for the Resultado Excelente dolls. And I'm in Boca Raton, which is right beside Miami in Florida. Okay, bye. Bye, guys.